feel they have not understood what healthcare program is required in India. So rather than going to the customer and finding out, hey, what are your needs? You are just delivering a system which is in abundance. And that is perhaps what has happened to, I don't know, to the US model as well. I mean, it's all insurance based. And that is, I am not very sure because I am not competent to comment on that. But I personally feel there's much more to healthcare rather than taking care of only sick people. It's much beyond. Please.
Sir,
Hi.
thank you for coming here. I'm Hemant, a first-year student here. I was glad to hear you talk about wellness promotion and prevention. You talked about water and malnutrition. I'd probably also add in sanitation and respiratory health with clean cooking in households. But ultimately, when people get sick, they have to get treated. And you spoke a little about rural healthcare. But in an urban setting, so if you look at maybe some of the northern states in UP and kind of second and third tier cities, I spent the past year working with kind of laborers and rickshaw drivers, and one thing we tried to do was get them access to healthcare. And a great challenge with that was basically what you just said. The only option for them is to go through the state, to go through the government, whether it's a government subsidized insurance plan or going to a government healthcare center. They're not going to go to a private hospital. And a problem with those kind of cities is there's a lot of process, and there's frankly a lot of graft and ego to deal with to get these very underprivileged people access to healthcare. And I found that urban healthcare is actually a real problem for, let's say, the bottom 15 to 20% in these poorer cities. And I'm just curious what you view as kind of a mid-range plan to getting these people access to healthcare. Do you think that kind of corruption and graft and transparency and direct funding from the state of these medical facilities has to be improved upon to get them access?
No, I think a bit of understanding the problem. We need to change our attitudes toward health, which I keep on repeating. At the moment, our attitude towards health is just the hospitals, the doctors, and I totally agree that if one is sick, one has to go. But if you look at the type of disease, when I mentioned about diarrhea, I mean, if you have good drinking, pure drinking water, then you will not have too many people suffering from that problem. If you have proper food available to the poor people, there will not be problems related to malnutrition. So these are the factors, and hygiene is a huge area. So what one needs to do is, as far as cleaning the hospital is concerned, I would like to outsource to the people who are in the business of cleaning. Those who are in, we have an organization in India, perhaps you may be knowing, is called the Sulabh Shauchalaya. And one can give the cleanliness to somebody who is good at that and their business to keep things clean. Having said that, I personally feel this model is not going to work the way it is working today, because there is no monitoring machinery as far as the federal government is concerned. So we need to encourage more and more private sector to get in there and cross-subsidize. In other words, that government will give you free land. And I'll give you an example which I was talking earlier with Mr. Jain in his office. I said that look at the railways. They have stations all over the country, in cities as well as in the remote areas. So if we can get some land from the railways, and incidentally the rail minister is my boss, Mamta Banerjee, and I have convinced her that give me a piece of land in every station, and we'll have the private sector, the federal government and the railway come to a joint partnership and open up outpatient wards and make sure that that population which is in the thick of the city or in the remotest village, railway station is everywhere. So at least few of them will be treated by the private sector, the railway and the federal structure all put together. And this is one of the models which I am personally working on. And if railways have a bigger land, then we can have bigger hospitals too. But capacity building is yet another problem. That, okay, you have hospitals, you have clinics, will we have enough doctors, nurses, paramedical staff? The answer is capacity building. And I was talking to Mr. Rajat Gupta of McKinsey the other day in my office. They are getting into the system of capacity building, which your university is doing here too. So capacity building is as important as opening up new centers for treatment. So a combination of all. But again, the bottom line is government can get involved, guide, facilitate, but ultimately it has to be a partnership. And somewhere down the line, I am sure insurance company also will get involved. And one of the model is today, the Ministry of Labor has given 30,000 rupees yearly to the families which are known as living below poverty level. And that 30,000 can be used for going to the doctor, is going to be cashless. So all you do is just take the smart card, get yourself treated, depending on what is the amount, and that is debited from your card. So these are few of the systems which are going to get into the place, and that is where when the private sector sees that, okay, there's somebody who's paying for it, it's not totally free. They are going to get encouraged and they're going to be partnering with the government. Sorry.
Hi, my name is Pallavi Bansal. I'm a first year MBA student. I know we're talking about the public health, but my question is more related to how we can encourage innovation in healthcare. Before Wharton, I went to AIMS. Even though AIMS is founded on the basis of promoting research and new ideas, when I was at AIMS, more and more the budget was focused on providing just the basic care. So what is the Indian ministry doing about promote innovation? Because so far we have relied on the innovation from the Western countries to provide solutions to our problems, but we have a unique set of problems. So what is the Indian ministry doing to promote innovation?
No, I'm glad you have asked. There are two ways of looking at it. As far as AIMS is concerned, it was meant for providing excellence and a lot of research, etc., and referral place. That objective has not served the purpose because people from the villages are going to the city and city are all going to AIMS, various part of the country. So we have done two things. One, expand the concept of AIMS into different states. So we have got now 13 new AIMS-like hospitals going to different states in the country. So what will happen that, let's say if we have AIMS in Bengal, so at least people from Bengal will go to that AIMS in Bengal. They will not rush to Delhi. Similarly, elsewhere we will also have AIMS. So that rush will be taken care of. And secondly, we have this department of Ayush, which is homeopathy, Unani, Ayurvedic, and I was reading somewhere that Ayurveda was the first formal healthcare program as far as university level studies are concerned. So Ayurveda is gaining more and more acceptability because of the problem of side effects of allopathy. And this mother care, which is at the village level in the sense of this traditional medicines, I think is finding its way. And even for H1N1, Ayurveda and homeopathy had immediate answer for it. But people need to get more confidence. So we are tackling this problem in these two areas. But I have no doubt about one thing, that more and more people are, and big companies like Dabur, Baidyanath, they are getting into traditional medicine in a modern way. So all they are doing is marketing, so making people aware of it. And word of mouth is also spreading. So yes, traditional medicine is going to find a lot of acceptance.